Welcome to the Top Star Training. The Top Star Training is comprised of 6 workshops. This is the first workshop entitled Supersizing Our Children, in a series of workshops about preventing childhood overweight. This workshop was developed by University of North Carolina Center for Health Promotion and Disease Prevention for the NAPSAC program. NAPSAC is an acronym for the Nutrition and Physical Activity Self-Assessment for Childcare. This workshop was revised by the Utah Department of Health, in which national data was updated and Utah-specific data included for the purpose of the Top Star program. The set of revised workshops is referred to as the Top Star Training and is approved for professional development credit. 10 hours of career ladder credit in levels 1, health and safety, or levels 5 through 8. While you listen to this presentation, you may want to boost your metabolism while you learn by getting up out of your chair and stretching or doing some strength training exercises, such as crunches, leg lifts, bicep curls, and/or lunges. This workshop will introduce you to the issue of obesity and how it is affecting children at young ages, and how you can help. It will be followed by workshops on healthy eating and physical activity. At the end of this workshop, you will be able to describe the problem of overweight in 2 to 5-year-old children, list the possible consequences of being overweight as a young child, describe the role of the childcare environment and of childcare staff in helping to prevent overweight in children, and list some ways in which your childcare facility can help children eat healthier and get more activity. We are first going to discuss the obesity crisis and how it is affecting the general population. Obesity is increasing in America, especially among children. Obesity is caused by many factors, some of which we cannot control, but many of which we can. Childhood obesity puts kids at an increased risk for health problems later in life. Childcare is an ideal setting to teach children healthy habits and combat childhood obesity. Over the past 20 years, there has been a dramatic increase in obesity in the United States. This slide illustrates this trend by mapping the increased prevalence of obesity across each of the states. In 1990, there were no states with the obesity prevalence greater than 14%. In 2006, only 4 states had a prevalence of obesity less than 20%. 22 states had a prevalence equal to or greater than 25%. 2 of the states, Mississippi and West Virginia, had a prevalence of obesity equal to or greater than 30%. In 2009, only Colorado and the District of Columbia had a prevalence of obesity less than 20%. Utah had a prevalence of obesity of 23.5%. Obesity is caused by ingesting more energy, or calories, than is expended, or burned, over a long period of time. Excess calories lead to an accumulation of body fat. Body mass index, BMI, is the standard obesity measurement used by health professionals. BMI is based on a weight-to-height ratio. If the BMI is between 25 to 30, an individual is considered overweight. And if an individual's BMI is greater than or equal to 30, the individual is considered obese. Approximately 59 million American adults, or 31%, are considered obese, and more than 64% of U.S. adults have a BMI greater than or equal to 25. Utah's estimated population is over 2.6 million, with roughly 1.8 million adults. Of those adults, more than half are overweight or obese, 59.4%. The percentage of obese adults in Utah has doubled since 1989, a 136% increase. The primary behaviors causing the obesity epidemic are well known and preventable: physical inactivity and unhealthy diet. Despite this knowledge, only 23% eat fruits and vegetables at least 5 times a day, and 20% report no leisure time physical activity in the past month. The problem is not limited to adults. 11% of Utah youth, 9th through 12th grades, are overweight, and another 9% are obese. Only 48% meet physical activity recommendation levels. Only 18% eat fruits and vegetables 5 or more times a day. Nearly 17% drink at least one non-diet soda each day. 18% watch 3 or more hours of television each day. Overweight and obesity and their associated health problems have a significant economic impact on the U.S. healthcare system. In the United States, obesity costs $150 billion per year, or $1,400 per person per year. In Utah, obesity costs $393 million per year. Medical costs associated with overweight and obesity may involve direct and indirect costs. Direct medical costs may include preventive, diagnostic, and treatment services related to obesity. Indirect costs relate to morbidity and mortality costs. Morbidity costs are defined as the value of income lost from decreased productivity, restricted activity, absenteeism, and bed days. Mortality costs are the value of future income lost by premature death. There are many reasons why children and adults are overweight. It is a very complicated health problem. There are factors that are not within our control. We cannot change our genes, and sometimes we cannot change a health condition that restricts activity or requires medications that cause changes in appetite or weight gain. Some people use food more efficiently and are more prone to gain weight. During times of famine, this was a genetic advantage, but in today's society, it is not. There are many more factors that we can control, including what we eat, how active we are, and how we interact with each other around food, and the amount of screen time. Ask yourself, what can I do to prevent obesity in the children under my care? Some suggestions may be: get the kids up and moving. Encourage staff and families to turn off the television. Offer healthier food options. And be a role model for healthy habits. We will go into detail on each of these things throughout the Top Star workshops. As little as 100 extra calories per day can cause a person to gain weight. It is important to make sure you compensate with physical activity to create a balance between energy in and energy out. As you can see from these charts, just adding 2 Oreo cookies each day could lead to weight gain unless you also add more physical activity to expend those added calories, such as biking 4 miles at 10 miles per hour. The total amount of daily calories consumed has increased dramatically for people of all ages and both sexes, men, women, boys, and girls, compared to the 1970s. Consumption of food away from home increased from 18% to 32% of total calories from 1977 to 1994. In 1997, the average American consumed 53 gallons of soft drinks and 17 gallons of fruit juices or drinks. Soft drink consumption has increased 51% since 1980. Fruit juice consumption has increased 40% since 1980. Boys consume 300% more soft drinks than in the 1970s, from 7 ounces to 22 ounces per day. Children's sugar consumption is twice what is recommended. Children today have diets full of high-energy dense foods, which are foods relatively high in calories, such as refined grains, added sugars, and fat food, which lead to obesity. On the other hand, offering children foods lower in energy density, which are foods such as whole grains, fruits, vegetables, and legumes, provide a protective effect against overweight and obesity. The theory behind this protective effect is that high-fiber foods are high in volume, yet low in calories. This greater volume may help kids feel more full while consuming fewer calories. This takes effort in a day and age where processed, quick, kid-friendly snacks and meals are readily available to feed children, but may not necessarily be the best option. According to the U.S. Surgeon General and the Institute of Medicine, policy and environmental changes will be needed to control the childhood obesity epidemic. We will discuss factors in the environment that make it hard to eat smart and move more. Think about this question for a moment. What factors in the environment make it harder for us to eat smart and move more? A study by Ewing and colleagues used national data from the Behavioral Risk Factor Surveillance System and census data to look at physical activity and urban sprawl. They discovered that the County Sprawl Index had small but significant associations with minutes walked, obesity, BMI, and hypertension. Residents of sprawling counties were likely to walk less during leisure time, weigh more, and have greater prevalence of hypertension than residents of compact counties. Walking rates increase when streets easily connect and when residential and business services are co-located. Physical activity levels are linked to having recreational facilities nearby. Many areas, especially low income, do not have parks, trails, and gyms within walking distance. This holds true for having parks and green spaces close to residences. Absence of places to be active relates to levels of physical activity. Diet quality is affected by the types of food establishments around us. The more fast food outlets, the more frequently people go to these businesses. We all know the challenge to healthy eating that are posed by fast food consumption. The popularity of supersizing has resulted in intake of unnecessary calories. The menu lacks whole grain options. Many menu items are fried in cheap saturated fats. A recent study showed that the availability of fast food, excluding coffee shops, ice cream, soft drink and soda fountain stands, and full-service restaurants, non-fast food, were more available in low and middle-income neighborhoods compared to high-income neighborhoods. In addition, neighborhoods that were predominantly black versus white neighborhoods had higher proportions of fast food among total restaurants. More and more we are eating outside of the house. It's quick and convenient. Ask yourself, how many times do you eat out during the week? Where do you typically eat out? Many health professionals believe that the increase in our eating out is a big factor in our weight gain. Restaurant serving sizes tend to be much larger than we would eat at home. Sometimes they can be 3 to 4 times the amount of food that is recommended. Over the past 20 years, there has been a major change in portion sizes when eating out. For example, French fries used to come in one size. Now there are multiple sizes and all are bigger. Talk about calorie difference. Most restaurants use the cheapest ingredients that make the food taste the best. This often involves adding a lot of fat and sugar to their foods. This results in high-calorie foods. We probably don't even realize how many calories we are eating when we eat out. We tend to drink more high-calorie drinks when we eat at restaurants because they use tall glasses and there are often free refills. A 20-ounce regular soda contains about 250 calories. The higher the density of convenience stores and mom-and-pop stores, the poorer nutritional quality of a person's diet. This holds true for the absence of grocery stores. A recent study showed that an increased availability of chain supermarkets was associated with lower adolescent body mass index, BMI, and overweight, and that greater availability of convenience stores was associated with higher BMI and overweight. The association between supermarket availability and weight was larger for African American students compared to white or Hispanic students, and larger for students in households in which the mother worked full-time. Food prices have been rising from the 60s to the 80s. Unfortunately, between 1985 and 2000, the nominal price of fresh fruits and vegetables, fish, and dairy products increased by 118%, 77%, and 56% respectively, whereas the nominal price of sugar and sweets, fats and oils, and carbonated beverages increased at much lower rates, 46%, 35%, and 20% respectively. No wonder we are stocking our kitchens with less healthy foods. Although the research isn't abundant in this area, the environment-behavior relationship exists in our work-school settings as well. There are some environmental aspects that have a potential link to obesity, such as food choices in cafeteria or school store, places to be active or quality of outdoor space, is there time to eat, where to store food brought from home. Work is physically undemanding. We don't even step next door to speak to a colleague. We send an email. What we do at home before and after work, school, and on the weekends has a big effect on our ability to maintain our own weight and those of our children. For instance, what food do we keep in our homes and make readily accessible to our children? Research shows that homes where fruits and vegetables are not only present, but accessible, meaning cut up on the counter or in the refrigerator for children to grab, have children that eat more of them. Also, children who live in homes with more family meals eat more fruits and vegetables and fewer calorie-dense foods. Adults control what enters the home. This is true in childcare as well. Family traditions also play a role. Is it tradition to go outside after dinner or watch TV? Research on the home environment is very limited, but much interest exists. Some evidence shows the importance of exercise equipment in the home, number and location of TVs, and space for outdoor play has an effect on weight status. We do know more about the media's influence, especially TV. Watching TV is related to obesity, whether from snacking or inactivity. Increasing time spent outdoors has a positive impact on a child's physical activity. A growing body of evidence suggests healthy sleep routines are protective against obesity, 10.5 hours per night for young children. Now we are going to talk about the overweight problem and how it relates to children. A lot of children attend childcare these days, the majority of whom are in childcare centers. They spend just as much time here as they do at home. This is why the childcare environment is so important. In 2005, 56% of children ages 3 to 6 were enrolled in childcare centers. What a great opportunity to make an impact. Body mass index is also what health professionals use to measure if children are overweight or obese. A child's BMI is determined from their weight and height measurements, just like adults. This number is then plotted on a growth chart based on the child's age and sex to determine their BMI percentile. If a child's BMI falls between the 85th and 95th percentile, the child is considered overweight. And if a child's BMI is at or above the 95th percentile, they are classified as obese. Currently, 26% of U.S. children aged 2 to 5 are classified as either overweight or obese. This graph shows a threefold increase in the obesity rate for 2 to 5-year-olds since the early 70s. Some groups, for example Mexican American 2 to 5-year-old boys, are disproportionately affected. Every year, more and more preschool children are considered overweight. Preschool children who are overweight are nearly 5 times more likely to be overweight as young adults. The longer a child is overweight, the more likely he will be an obese adult at risk for many chronic conditions and health problems. Starting prevention programs early is a good idea. Utah Department of Health, Bureau of Health Promotion collected heights and weights on elementary school-age children in 2002, 2006, 2008, and 2010. This graph shows the prevalence of overweight and obesity among first-grade boys and girls in 2002 and 2008. More boys than girls were at an unhealthy weight in both sample years. First-grade girls showed an increase in unhealthy weight from 2002, 13.4%, to 2008, 18.3%. Obesity among first-grade girls increased by 50% from 2002 to 2008. Clearly, obesity prevention needs to start in the early childhood years, as too many children, nearly 1 in 5, are already at an unhealthy weight at the time they are in first grade. As of 2009, approximately 1 in 5 Utah WIC preschool-aged children were at an unhealthy weight. The rate of overweight among WIC kids aged 2 to 5 has increased from 11.9% to 12.3% from 1990 to 2009, while obesity increased from 5.5% to 8.8%. The WIC data shows a disparity between race-ethnic groups for prevalence of unhealthy weight among children ages 2 through 4. The rate is much higher for Hispanic, 67% higher, American Indian, Alaskan Native, 146% higher, and Asian Pacific Islander children, 88% higher. By now, you probably realize that we should be concerned about the weight of children in childcare. Overweight is very common. In fact, in some communities, it is so common that the parents of very overweight children do not see the problem. So many of the children they know also are overweight that they are used to it. The longer a child is overweight, the more likely he will be an obese adult at risk for many chronic conditions and health problems. Think for a moment. What health risks are associated with childhood overweight? We will discuss some. Some children are just big kids. They have bigger bones, are taller, and are heavier than other children. But most of the children we are talking about today are at an unhealthy weight, meaning they are carrying too much weight for their body size and thus are at risk for certain diseases later in life. 60% of overweight children 5 to 10 years of age already have at least one risk factor for heart disease, such as high cholesterol, high triglycerides, or high blood pressure. Many overweight children have difficulty keeping up with lighter peers and they get tired more easily. Children with asthma who are also overweight may have increased symptoms, and in extremely overweight children, breathing problems can be very severe. Type 2 diabetes used to be called adult onset diabetes but now it is being diagnosed in children as young as age 9. Problems with joints, like the knees, hips, and spine, usually don't show up until adolescence or adulthood, but carrying extra weight over many years takes a toll on the body. Our bones were not intended to carry and support too much extra weight. Children who are overweight sometimes suffer from weight discrimination. Their peers and sometimes adults make assumptions about them because of their weight, such as lazy, no self-control. Children can be cruel and may ridicule or exclude overweight classmates. This can lead to depression and low self-concept. Other health risks could be depressive symptoms, low self-concept, poor body image, fatty liver, and more likely to be obese as adults. Adults control most of these contributors to child obesity. Food choices. Diets higher in calories, including fats and simple sugars, and lower in fruits and vegetables are linked with overweight. Physical activity versus sedentary activity. Less physical activity and more time spent participating in activities such as watching TV result in less energy expenditure. Parental obesity. Children of obese parents are more likely to be overweight themselves. There is an inherited component to childhood overweight that makes it easier for some children to become overweight than others. There are a number of single gene mutations, genetic alterations, that are capable of causing severe childhood overweight, though these are rare. Even children with genetic risk for overweight can still become overweight only if they consume more calories than they use. Parental obesity may also reflect a family environment that promotes excess eating and insufficient activity. Eating patterns. Skipping meals or failure to maintain a regular eating schedule can result in increased intake when food is eaten. Parenting style. Some researchers believe that excess parental control over children's eating might lead to poor self-regulation of kids' energy intake. Diabetes during pregnancy. Overweight and type 2 diabetes occur with greater frequency in the offspring of diabetic mothers, who are also more likely to be obese. Low birth weight. Low birth weight, less than 2,500 grams, has been shown to be a risk factor for overweight in several epidemiological studies. Excessive weight gain during pregnancy. Several studies have shown that excessive maternal weight gain during pregnancy is associated with increased birth weight and overweight later in life. Formula feeding. Breastfeeding is recommended over formula feeding. Although the exact mechanism is unknown, several long-term studies suggest that breastfeeding may prevent excess weight gain as children grow. Parental eating and physical activity habits. Parents with poor nutritional habits and who lead sedentary lifestyles role model these behaviors for their children, thereby creating an obese genetic home environment. Demographic factors. Certain demographic factors are associated with an increased risk of being overweight in children. For example, there is evidence that African American and Hispanic children 6 to 11 years old are more likely to be overweight than are non-Hispanic white children of the same age. Asian Pacific Islander children of the same ages were slightly less likely to be overweight. Focus on the things we can change, such as the types and amount of foods and beverages we offer children, the opportunities children have for physical activity, the amount of screen time children have, the messages we give children and families about food, eating, and physical activity. Support breastfeeding mothers and children. You can make a difference. Child care providers are great role models for children. Be an advocate of a healthy lifestyle and for healthy children. Take a minute to think about the following questions. What is the role of childcare? What can you do to prevent obesity in preschoolers? Pull out the handout that says, Improving your center's nutrition and physical activity environment. Fill this out individually or as a group to help you begin thinking of ways that you can make changes. The handout is attached on the following slide. Some suggestions are: discuss healthy habits, not body type. Choose healthy food to serve, but allow children to choose what to eat. Serve a variety of foods with more fruits and vegetables and whole grains. Bake, broil, roast, or grill meats instead of frying them. Limit use of high-calorie, high-fat, and high-sugar sauces and spreads. Limit juice. Make water available at all times. Be active as a group. Encourage free play. Provide time outdoors. Role model healthy habits. Restrict screen time. Support breastfeeding mothers and children. And make things fun. Too many children are overweight and at risk for serious health problems. Unhealthy food choices and physical inactivity contribute to unhealthy weight. Together, we can make a difference.